Okay. Good afternoon, good morning, good evening, buenos dias, bonjour, bon dia. Welcome everyone to this 8th session already as part of the Scaling Up Health Adaptation Measures to Meet the Climate Change Challenge in the Americas. And today we're going to talk about a very important and difficult topic, scaling up health adaptation and leaving no one behind. I am Gerry Eikemans. I am the director of the Department on Social and Environmental Determinants for Health Equity at the Pan American Health Organization, Regional Office of the World Health Organization, and I'm very pleased to be your moderator today. And as I said, the topic of today and the speakers of today are going to be very exciting, so we're looking forward to a very interesting coming 90 minutes. So let's look at the usual. So as you know, there is interpretation, English, French, Portuguese, and Spanish. You're going to need it today because we have speakers in different languages. So please go to the interpretation button and make sure that you have the right interpretation. We all know all the sponsors that we see behind. We are very, very grateful to be part of this very important course schedule. As I said already at session 8, scaling up health adaptation, leaving no one behind, focusing on equity, on health equity in this session. And of course, you already know the course objectives. I'm not going to go through that. You have the slides, you'll get them. This is the same as every time, but we're going to look maybe a little bit at session 8 objectives here. We have as learning objectives to identify the key principles of inclusive scaling up and recognize how poorly planned or implemented adaptation efforts can, without us wanting to inadvertently worsen health disparities. This is extremely important. Then we're going to, one of the objectives is to distinguish between tokenistic consultation and meaningful engagement approaches when working with diverse communities. We also are going to understand the importance of Indigenous-led health adaptation and recognize the basic principles for respectful collaboration with Indigenous communities, and to recognize warning signs that adaptation initiatives may have inequitable impacts, and to understand the opportunities through the VNAs and the monitoring and the surveillance to make the course correction. So very important topics. As we all know, any crisis, if we do not properly from the very beginning take into account the vulnerabilities and the populations in situation of vulnerability, it can make the situation worse, even despite our best efforts. So we have this 90-minute session. We are going to have the opportunity to have Q&As, probably since we have only 2 speakers today. We have a good time for that. So please enter your questions for the presenters in the Q&A that you see also on your screen. And you will have the session video recording, slide decks, and resources. They will be made available to you as usual. So you know what you need to do in order to get your certificates. So again, I'm not going into that. You have seen that in the past. And we're happy that you're here today in this session. So this certificate of participation, you have to attend 8 or more of those live Zoom sessions and pass the final exam. And well, I'm sure you're all ready to go to that exam in a few more sessions. Next one, please. And of course, we have our WhatsApp group. So please, again, here goes the QR code. Make sure that you're part of this WhatsApp group, so that you can connect with others and receive important course information and reminders. And now comes, of course, the most important part of the session. I'm going to introduce the presenters that we're going to have today. So we have Dr. Saint Kitts, co-director and senior scientist of the Institute for Mental Health Policy Research at the University of Toronto, Department of Psychiatry. He has impressive CV. I'm going to just mention that his areas of focus are including climate change and health equity and developing interventions for individuals with severe mental illnesses and youth who have experienced homelessness. And he is engaged in trials of housing stabilization interventions for youth experiencing homelessness and digital health interventions for severe mental illness and addiction. He has also founded the global and national knowledge mobilization networks in this area of poverty, health, and climate change. So with that, let me just quickly also introduce Patricia, and then we're going to go back to Sean. So Patricia Suarez Torres is from the Indigenous Peoples of Muri, of the Department of Amazonas in Colombia. She is a professor in social work, a specialist in human rights, master's degree in sustainable living systems for the Universidad Externada de Colombia, and the Indigenous Technical Secretariat of the National Commission for the Protection and Prevention of Indigenous People in Isolation or Natural State. She coordinates also the project plan for the protection and legal security of indigenous territories of the Colombian Amazon, and she's advisor to the National Organization of Indigenous Peoples of the Colombian Amazon, and leader defender of human rights and territorial rights. So with those two speakers, as you can see, we're going to have a fantastic session. So now, without further ado, I pass the floor to you, Singh, for the first presentation. Please go ahead.
Thanks so much for that wonderful introduction. It's an honor and pleasure to be here. I will get into slides in just a moment, but maybe before I start with slides, I'll just mention that I'm calling in here from Toronto, which is in Southern Ontario province in Canada, where it's early afternoon. And my home is situated on what's called in Canada Treaty 13 territory, most recently of the Mississaugas of the Credit and many other First Nations. And it's an honor to be here with Patricia to be able to speak about some of my work and hear about her work and have this conversation. I should say as well, this is a very ambitious agenda to try and cover in a short time. And I think it's an area as well, too, where sadly we don't have too many examples of scaled up adaptation measures that really address equity deserving populations. But I'm going to draw on what I consider my limited experience in this area with a focus on homelessness, try and tease out some key takeaways, and then hand it over to my colleague, and we'll take it from there. Also provide some resources to link out. This is an area where there's lots to read and lots to check out. So, and I will do my best for the sake of everyone listening and the interpreters to speak slowly, which I tend not to do very well or very much. Okay. Maybe Jerry or somebody could just give me a heads up that you're seeing slides okay?
Very good.
Okay. All right, great. Okay. So just get myself a little organized here. Okay, so just a few disclosures to get started. So we're fortunate with our group from sort of the global work through to national and local work to have funding from a number of foundations and organizations, mostly based out of Canada. No disclosures related to conflict of interest. And I would just say that if you're interested in seeing and reading more about what we're up to, and I'm only going to be able to cover a little bit here, you can go to our website there, where you can find everything we're doing, and most stuff is open access. And I'm going to share just as a starting point, because this is a broad, considering health equity, climate change efforts, and pitfalls related to adaptation. I think I thought it would be best to start with what I know, and an example I think that's an important one, and that has to do with people experiencing homelessness or living in inadequate or very poor housing circumstances, and the particularly profound exposures of those individuals to environmental risks, whether they're related to climate change or otherwise. Couple of pictures here. The one in the lower right is from Sao Paulo, Brazil, actually. Of course, the home of several of our hosts here. And that is a picture of a person lacking housing, trying to use found materials, scavenged materials, to create a climate or environment resilient and a space to survive in a street environment. The top left is a photograph from a slum outside of Nairobi, Kenya, a place of convergence for many people from all over Kenya, as well as from many places in Africa, a stopping point, an end point where people whose farms have failed, who've run into terrible forms of violence and conflict, and so a confluence of environmental risks as well as other social and political risks can end up, and exposures there to disease, flooding, result in terrible loss of life with infants and children and older adults being most exposed. But just a couple of images to hopefully center our discussion about the kinds of exposures that many people are facing. And what this is it's images like these and my experience working in the area of homelessness and severe mental illness that led me into this area. I'm a relative latecomer to the climate change table, aside from being a concerned citizen just the last 5 or 6 years. But this work really grew out of me being frustrated and unsatisfied with the systems-oriented responses and interventions that we see for people lacking adequate housing and wanting to do work in that area. And so, the context for people who are experiencing extreme poverty, and I'll focus here, as I mentioned, on people lacking adequate housing, is that there's a lack of inclusion in, the myriad disaster response plans, vulnerability assessments, all of these documents and processes that happen in many jurisdictions worldwide. If you do a search, and I have a long-suffering grad student engaged in just such a review right now, you'll find that topics surrounding poverty and homelessness, when they appear, which is not very often, it's very superficial. You don't get into concrete commitments and actions. Most of the time, there are exceptions, but that lack of inclusion is there. There's a lack of inclusion in adaptation and remediation plans. I get criticized sometimes about the work that I'm trying to lead and that my colleagues are involved. And something I should have mentioned at the beginning too. Here, as I speak, I'm representing many colleagues of different disciplines and partnerships from across Canada and globally. So this isn't just me. This is really a huge group effort that I'm representing here. But I should mention that in terms of inclusion, you see, getting back to my point, it can be criticized, poverty, climate, health. Could you pick a broader topic, a hazier topic? But the point that brings us together, that's brought our networks together, is if you scratch the surface a little bit, you'll find that beyond very superficial language about threat multiplier effects and compounded risks, we actually have very little evidence and very little involvement related to the specifics of who's impacted, how, where, and when. And if we intervene in some way, what are the metrics? What are the ways that we know that it's the work's that's being done is impactful? And what are the ethics? What kind of governance needs to happen? A lot of knowledge gaps, and that's what brings our group together. When we do see responses, they tend to be in the frame of reactive responses to crises. So and in some contexts, it takes the forms of heating and cooling centers, sort of places of respite out of environmental risks. They tend to be temporary, sort of pop up at certain times. Sometimes there's outreach, giving out water bottles, giving out supplies, trying to educate, those sorts of things. And as we've done, there are many reviews, and we've done quite a number of reviews and are still at that work, is just seeing an inadequate evidence base. And we see consistently, and this is something that will resonate with many, I'm sure, in this audience and taking this course, is that we have the most evidence from high-income countries and the least evidence from countries that are actually the most exposed. So where do you start? You've got a problem like homelessness and poor shelter, big thorny issue, very difficult to address. And our thinking as a group was trying to start off with good information. And if you could listen maybe here as I talk about this work to pull themes out, I know not all of you are going to be that interested in homelessness or housing and shelter. but the themes I'm going to try and tease forward, I think, are arguably relevant. So the first is, how do we get good information? I've mentioned, I'm going to go to the second bullet first here. I've mentioned reviewing the literature. We do need to understand what's out there and capture that regardless of the topic. And we've done lots of literature reviews at a high level and then more and more focused and trying to follow the leads, because each literature review will tease out questions and topics that are worth chasing down. Like, for example, we've done lots of reviews on poverty and homelessness. Most recently, we're in the home stretch of a review looking at the impacts of climate change on children and youth in education environments specifically, and what happens when there are environmental risk-related disruptions in terms of child development and learning. And that's an example for youth experiencing poverty and lacking adequate housing and so forth. So that's an example of us trying to start broad and get more specific, because we think in the specificity is an important information about how we intervene, how we influence policymakers who might not be interested in people experiencing homelessness, but might be concerned about what's happening in schools. Wherever we can get points of policy and government leverage and getting topics of interest, that's what we kind of want to uncover, and getting the best available evidence. Now, almost as important or even more important when there are enormous evidence gaps has been a whole lot of think tanks and points of engagement, trying to get the best minds together related to the topic at hand. In our case, homelessness and climate change, or extreme poverty, women's health and climate, the different iterations. And when I say the best minds, what I'm speaking about are not necessarily, and definitely not exclusively, the most privileged and educated minds, formally educated minds, that is. We've engaged people across an enormous range of jurisdictions, disciplines. We'll have calls where we'll have an emergency room physician, a heat physiologist, an epidemiologist, a city level director, all kinds of perspectives coming together around these different topics. We really spent a lot of time on lived expertise. By lived expert, I mean people who have experienced poverty, who've directly experienced climate risks, bringing their perspective in a range of ways I'll talk about as we move along, as well as engaging Indigenous communities and leaders to gain not just information about what's happening in Indigenous communities and with Indigenous individuals, but also to look at the kinds of ethical and fundamental frameworks in which we consider this work and how we respond. It's a lot of think tanks, and you can read up on how we did them, of different shapes and sizes. And we also have worked extremely hard to try and not be duplicative. And this is another theme I'm going to come back to. We have so little resource in many ways to do this kind of work. It's a waste to be doing the same thing as somebody down the hall, so to speak, or next door. So wherever possible, how can we connect with networks like Connecting Climate Minds? In Canada, there's the National Adaptation Strategy. There are groups with World Health Organization, the Blen Health Action Plan. So there are lots of groups coming together to try and stay connected and learn what others are doing and find our place and support work in a way that we're adding to and not contributing to confusion. And my and our job at many tables is to ask the question, what about people lacking adequate housing? What about severe poverty? And how we can understand whatever the topic is, whatever adaptation strategy is being discussed, how we can make sure that this topic's addressed. So in homelessness, signs that things aren't going well and that there's work to do. I mentioned not wanting to be duplicative. The last thing we'd want to do is create something, an intervention where one's not needed. So I think in our area, it's pretty clear there's a need. There's an enormous disproportional mortality, illness, morbidity, and suffering, and unfulfilled lives, lives that aren't thriving related to climate change around the world for people that lack adequate housing and are experiencing homelessness. We see, sorry, this might be an English sort of term or Canadian term, backfired plans that fail, that like cooling centers, trying to create spaces during extreme heat events where people who lack adequate shelter can get to cool off. We find in many instances when they're set up, they're not being accessed by people that need them the most, the people experiencing the most exposures. We also know from our heat physiologist colleagues that brief times in cooling centers and then going back to extremely hot environments in a home or outside for most of the hours of the day. It's helpful a bit, but it's not nearly as helpful as we'd like to think from a physiological and medical perspective. Ineffective outreach. People in many organizations do try to do outreach. Outreach means going out into street environments, going out into boarding homes, going out to places where people in these situations are living to try and educate about what heat illness looks like. Because, heat illness, you might be aware, people can get very hot. And if they don't know what's going on, they have a hard time communicating that knowing that they're getting unwell and that they're in danger, giving out water bottles and other supplies. Often these efforts aren't reaching who they need, and they're often not sufficient, not adequate. In some contexts, mostly high-income contexts, we see schemes to give out free or rebated air conditioners not working. They're not accessed because, as we'll learn from our lived experts, if you get an air conditioner in, first off, many landlords and building owners don't want them because they don't want to pay for the electricity. Second, if you install them, the apartment or place you're living is seen as worth more, and you can be evicted because you can't afford it anymore. So they've been seeing backfired plans, and air conditioning generally, as many of you will know, is not really a sustainable solution anyways. So what are the risks of all this? I think that was one of the learning objectives. I think there are many. One of the big ones is a false impression, because these kinds of activities will be in the newspapers, will be talked about, will be sent out in social media, will be put in annual reports by organizations, talked about by governments. These can give a false impression that work's being done. And I don't want to say that these are completely without effect, or that people are doing this work are completely misinformed, or any extreme thing like that. But I think it can give the impression that there is work happening at an extent and a scale and an impact when it's maybe and even probably not happening. And that can lead to reduced motivation to do other things. So there's a risk when you're engaged in things that aren't impactful and effective and based in evidence, of course, that we're wasting time and money. There can be a lack of investment. There can be these reactive interventions. And as we know from the mental health space and the profound failure of deinstitutionalization in the 1960s and 70s and on, that if you don't fund backbone sustaining structures in community contexts, you will leave organizations to figure it out on their own with philanthropy and various grants and so forth. People experiencing poverty are not served well, fall between the cracks, and it falls apart. You have short-lived interventions, sometimes even very effective interventions, but it doesn't work. A really pervasive thing, maybe one of the most important risks, is stigma and cynicism. We see this a lot right now about people experiencing mental illness, addictions, experiencing homelessness, where the public, where the government and governments get cynical about can anything be done and lose interest and energy, stop investing. The public can be more stigmatizing, seeing these systemic problems as failures of willpower and failures of individuals. I won't get into that more, but these are just a handful of risks that can happen. Getting into homelessness specifically, I want to give some examples. We found there are two main themes, and I'm not going to get into all this, just going to give a few examples. So we found there were two topics related to homelessness and poverty and climate that come out in the literature, that come out in conversations. One is migration. Of course, there's a lot of work being done on climate-driven migration. What we tried to tease out was migration to what exactly? And often it's migration to worse and worse housing, if not outright homelessness. Of course, it's impacted by many factors. You've got the risks related to climate change, such as loss of housing being destroyed. There are many different moderators depending on what's happening in your life, the resources you have access to, the country or jurisdiction you're in. And then you get the outcomes ranging from exposure to violence, which we see, especially amongst girls and women, right on through to mortality and death. And so this is the scheme that we came up with related to migration. And then, of course, there's exposure. This is addressed a little more directly, is people living out of doors or in bad housing obviously are more exposed to any number of environmental risks. I've listed the risks here, and you just see factors that compound risks, such as the how bad the housing is that you're living in, and we could have misunderstandings too. For example, in the 2021 Western heat dome, most people who died over the course of those couple days who were living in bad housing, most with mental illness and physical health problems, were actually in housing. not on the street. So they're in a little bit, people living homeless were at risk for sure. But being in bad housing where you can't open a window, too many people in a room, you're wearing too many clothes, no one's checking on you, you're isolated, you're actually at a greater risk of dying in some ways, at least in that event. And then we got the outcomes that are just straightforward in there. So what do we think about as we move along with this work? Um, and here I'm going to touch on a couple of things because I think this is relevant to the idea, the concept of scaling out any kind of intervention, and then as well locating the problem. So first off, I'm going to talk about models of intervention, just giving a few examples. The papers that are in the slide deck here go to town on this topic, are extensive about this topic and give you examples where you can see, case studies of where this work's happened. But I'm going to provide models and then guiding principles. This comes out a little more from my work in youth homelessness, perhaps, than climate change. But when you're in a diverse set of contexts, everything from small towns, rural environments, very big cities with many organizations, there's no one model, there's no one intervention that's going to look the same, run the same, and be equally impactful everywhere for everyone. There can be a problem sometimes in the concept of scaling out, where if you really see it as kind of bottling an intervention and putting it out everywhere in the world the same way, you're almost doomed to fail in most instances, at least in the context of complex interventions with people experiencing poverty. So I'm going to talk about models, but then also guiding principles. Guiding principles can help because the value of models is really pinning down and having standards and being able to assess the fidelity to something we know works, but you need that flexibility. And that's where guiding principles come in, where aspects of a model might shift, pivot, flex, like with our Indigenous partnerships in Northern Ontario with First Nations there. We have peer support workers who work with youth experiencing homelessness. So these are young people who've been homeless themselves who work with us as team members and engage youth and are great members of our team. In the north of Ontario with Indigenous partners, First Nations elders were actually the facilitators of the peers, which was very different than Toronto. So that's an idea. You've got the same model, but the guiding principle about you engage the local culture. They assume leadership and they have a framework to work in that we all agree we're trying to do. And then the second thing I'll just mention, many of you will be familiar with language, from public health and other places of wicked problems. Just the idea that these problems that I'm talking about here are extremely complex. And we've been finding, if not even obsessing about trying to engage experts in complex systems, because a problem we can have in the area of homelessness for any given context, probably with a problem of homelessness, you could be doing 50 different things to try and address the problem. And we have very little resource to work with. And we also see situations where interventions that seem like they should work, like going out and doing education about suicide prevention or whatever the thing is, sometimes a lot of money and effort is put into those interventions, and you find out afterwards nothing happened, or maybe even things get worse. And that's because this, and it's not like these are bad people who didn't do their research, going in and doing superficial sorts of things. This, I think, is important, brings up the importance of using a complex systems analysis to really deeply understand what's happening locally and identifying those points of leverage where you engage local knowledge to look at where, if you intervened, you get the biggest effect for limited resource. In the area of youth homelessness, it's engaging youth who found some kind of stable housing after homelessness, at least in my work, where you can double down on resources to make it stick, to allow them to keep housing. It's an example from at least the homelessness world. And there are many others. Okay, moving along. Okay, so I'm going to give a couple of examples. I'm just going to have a look at the time here, doing okay. So from climate and homelessness, if you look at responses, here what we try to do, and all the work that I try to do, whether it's about climate change or about homelessness broadly or severe mental illness, is as much as possible, and it's really obvious that we need to concentrate on prevention as best we can. It's far more impactful. You have far more opportunities to intervene than when somebody or someone's family is living in that slum I showed a picture of outside of Nairobi, or is living in a tent in Sao Paulo. When somebody's reached that situation, it's so much more difficult to intervene, so much more costly, and it's kind of like the complex systems people will talk about feedback loops, and where we argue a lot about housing and shelter as being a point of leverage is that when you lose adequate shelter, there's a feedback loop where everything gets exponentially worse. It's harder to work, it's harder to maintain your health, get enough food, protect and look after your children and parent. Everything gets exponentially harder, and then you get this feedback loop happening. So it's not like a stepwise incremental increase in risk when you lose shelter that's adequate. It's compounding and complicated. So that's why we're fixated on shelter here, amongst the many things one can be doing in the area of poverty. So getting back to our examples here. So in the area of migration, and in the paper I share in this deck, there's some examples of this, a few examples from around the world, is facilitating staying in place. So not waiting until the hurricane or the cyclone has destroyed the farm, destroyed the homes, or there's been some other disaster that people are leaving wrecked homes and livelihoods and fleeing. Often, especially, when we collaborate with climate scientists and others, we can understand the spaces where people are at risk. There are some areas that probably can't be preserved, and a decision and discussions and community engagement needs to happen about a move. But there are other places where some engaging engineers, architects, and others in communities, you can build resilience and facilitate staying in place with forethought and planning in a prevention sort of frame. So when the storm comes, everything isn't lost, and you have an opportunity to prevent that absolute worst outcome, which is the terrible pictures we see and people that we see in our work of people fleeing with their families, with whatever belongings they can carry with them. In terms of exposure, really emphasizing that this crisis-oriented exposure is necessary, but wouldn't it be great to avoid this with good prevention activities, with good engagement on the prevention side? We have far, far less exposure as in people experiencing homelessness, lacking housing altogether. But when it does happen, and there are examples, number actually out of Australia in particular, but also around the world, where when you engage community organizations that know the communities that are experiencing homelessness, if they're Aboriginal or Indigenous, those relationships are there. The work's being done by people within communities, or otherwise, where you engage people and use co-design. By that, I mean coming together and saying, hey, we agree there's this risk related to heat and humidity, for example. What do you need? What do you need to know about heat illness? How can we communicate that? How can we communicate in relevant ways by people who are trusted? What supplies do you need? And how should we get them to you? How do we get to those people who aren't easily found? And having done quite a bit of outreach and engagement in street environments myself, I can say you get a range. You've got people you can easily find on major thoroughfares and streets and cities. There are people that if you don't know somebody who knows where they are, you'd never find them under a bridge, in a small forested area, and those sorts of things. So this is where you can engage in co-design, and so you have a plan and you can do outreach in a way that's as best informed as possible. Again, outreach to people experiencing homelessness is not as effective, or never will be, as giving people adequate shelter in the first place. But if you're forced to do it, this is the way to do it. And Lynn Keevers and some others in Australia have some great examples of how to do this. Guiding principles. So those are a couple of models. But now backing up to guiding principles. And here we can say that you can do a lot of different things. And as long as you're sticking to some of these guiding principles, you've got a better shot at what you're doing being impactful. So a few things. So I've already talked a lot about emphasizing prevention. How do we generate data as well as trying to understand all kinds of data, what's working and where and how? And emphasizing adequate housing, coming back to that idea of shelter. You could also emphasize community engagement. There are some fundamental principles that we can emphasize in everything that we try to do that will make whatever the intervention is better and more impactful and more equitable. Inclusion of lived experience. I've talked a lot about this, and this includes engaging those direct service providers, engaging the different organizations, all kinds of organizations. So not just health service providers or community service providers, spiritual leaders, Indigenous elders, all of the people who in different ways engage community, provide supports, or leaders, provide services, engaging them in the discussion, but not solely them, but also the end users too, in really robust ways. And then, of course, you probably heard lots about this in the course already, is localized solutions. And so this is where you can have a backbone of support. Remember, I already shared the cautionary tale of solutions that rely on local organizations, but don't have that organizing backbone of funding and support. It's not going to be that sustainable. But localized solutions that are then aligned with existing values and practices. Because if you go into a community and say, hey, unfortunately, it's looking like these houses are going to, they're just too exposed. You all are going to have to move and your farms are exposed too. It's not going to go well. It's how is this, can this be done with proper community engagement in languages with and through cultural frames that people understand, and done in a way that's culturally relevant and equitable, and they have a better chance again at having impact, but then also having something that's sustainable. I should say too, another peril here, and maybe some of you have seen this, I know I've seen this, is where you see initiatives, models deployed that rely a lot on one or a small number of highly charismatic people. Or it's at a unique time where things, you got lucky, you've got the perfect policy alignment, you've got that senior government official who's passionate about the project, who knows the charismatic person. Great work happens, and these are inspiring stories, but I think a key thing is that those inspiring stories can also be misleading, because we need approaches that can work in environments where you're not super lucky, where you don't necessarily have a leader who's incredibly charismatic, where everything's lining up. Is how can we, because I think scale, that's important to touch on as well, because if we try to scale out something that is, again, this is maybe an English term, a unicorn, it's like this very rare mythical thing, it's not going to scale out as well. Okay, moving along here. There's a pretty good paper here that's in the slide, and you can check out. I'm going to start to talk and dive into a little bit more about inclusion, which is kind of one of the focuses here. So a couple of general things. So adaptation work, not too surprisingly, tends to be more inclusive than mitigation. This review points out that a lot of the mitigation efforts tend to be highly technical, professionalized, and don't engage people with lived expertise enough. A dialogue in the area of homelessness I've heard about, of course, we spend a lot of time, and rightly so, don't get me wrong, this is not like it's a bad thing, it's actually quite impactful. But for example, talking about creating more green spaces in urban environments, getting more trees up, obviously important for mitigation sorts of purposes, also adaptation for that matter, but it can slip in the direction of, I've heard discussions about having more shade for people experiencing poverty and lacking housing to access. As well too, which is problematic, right? Is if as a society we're planting more trees to create more shade for people experiencing homelessness to get under, we're not looking in the right direction. As well too, people will talk about how you get accidental gentrification. You put in lots of nice trees and parks and things, the property values go up and people are kicked out. So that's an example where in mitigation you can do engagement, that more inclusive engagement to offset risks like that. And of course, get a huge range. There are many kind of rulers or levels of engagement schemes that use different language, but it boils down to you start with complete exclusion, and on the one end, and on the other end, you've got co-leadership where us more technical folks or researchers and otherwise we're supporting cast. We're in the background supporting, but it's really communities that are leading the effort. And I'm going to talk a little bit about some of my experience with trying to foster inclusion in a meaningful way and in a way that's sustained. So I'm going to go through some of the foundations I think that are important. So I'm going to I think I might have missed a point. Nah, I'll come back to it later. Well, maybe I won't, just in case I forget to mention it later. So we're having a discussion today that touches on inclusion and scaling out of interventions. And I've seen a fair bit in community context, something that can be really unfortunate. Kim Hopper, who's done a lot of work on adult homelessness in the United States, he has a term that I kind of liked. It can sound a little cynical, but my apologies for that. But his term was called reckless hopefulness. And by that, he meant people like me, that go into community contexts and can begin out of good intent, trying to build energy and maybe believing it to promise a lot of things, to talk about big sustained impacts that are going to scale out, make a difference, change policy. And you can get people pretty excited about that, people that haven't had access to those kinds of things, that haven't had access to their rights or the kinds of services and supports that they need. And at the end of the day, when the project and so many projects, maybe they work for a bit, most fail and aren't sustained. At the end of the day, you walk away and you can have a very disappointed community that felt like for a moment there was some hope. But then I've moved on to the next grant or the next thing. The Land Rovers are driving back down the road. It's over. And then the community is left with that, with maybe there were benefit, but maybe actually having run that in that way and then leaving is worse than having never been there at all. It's just important to think about. So that's why I think it's the idea of true inclusion, where you're being ethical about it, actually does imply scaling out and does imply impact, because then you're not just engaging in reckless hopefulness. You're actually trying to promise things and engage people in things that are going to make a difference in the long term. So, an example from my work, and my favorite moments, whether it's engaging youth experiencing homelessness or diverse people lacking housing, exposed to environmental risk, are when projects and initiatives come up that are not my idea or my professional colleagues' ideas, but come from the community itself and point out a gap. That's something that I didn't see. So, landlords came up in a discussion with our lived expert advisors. So these are people that have experienced poverty, have experienced environmental risks, have lost people in their lives to environmental risks. And they pointed out that landlords have a huge amount of power in deciding about your living environment, what can go in, what you can do, when they try to kick you out, or when they do kick you out, putting you out on the streets to face environmental risks, who can come in as a support. They have an enormous amount of power. And if you look in the literature, you see almost nothing on landlords. So you've got people who are lived experts saying landlords are extremely important. We look at what the academics like me have been talking about, nothing much. Hardly anyone's talking about landlords. So this is to my mind, a great example of where inclusion is really important, because it points out something very important in the system that I would have never come up with or seen, or maybe not have dug this deeply. So how do we make how do I make the work that I do and try to, I'm not going to say I'm perfection, that I am perfection or that I'm the ideal in this, but there are some foundations to doing good inclusion, I think. So having a track record. This is hard for early career folks because it takes a long time. Believe me, I've sat in many offices and many uncomfortable conversations when I was very early career and sweating as people challenge me and test me and see, are you just another one of these academics that does his stupid surveys and then leaves and does nothing for us? Are you a racist in disguise? Are you like, what are you? You coming out here to us to talk to us and engage? What are you, what are you pushing here? So over the years, though, going through some of those tests, and they can be very uncomfortable and anxiety provoking, you build trust and you show you have the right values. You show you can make mistakes, but you engage and learn from the mistakes and are humble, patient, all these kinds of things to build that track record really helps with engaging communities that are equity deserving. Really looking at all the collaborations, for scaling out. Like, how do we make sure so we're not recklessly hopeful? How do we make sure that we've got the connections with providers, community, policymakers, and scientists and others, so that what we say, the promises we make, and we make modest promises, we have something to stand on, that when people tell us important things from their lives, that something will be done with it. It's not just recorded and forgotten in a filing cabinet. And then also consistently working on the longer term resource strategy. The second I get one grant, I'm thinking about where the next funding is going to come from. And in the ideal world, it's only happened a couple times in my career, is getting permanent government funding for something that started as a project. That's the end goal. And I've covered the last bullet there already. So what do we have? We have an advisory. I mentioned very diverse advisory. We've got sign language interpreters for people with some disabilities. We've got some asylum seekers. I've got people who've been landlords themselves that come together. We talk about climate, poverty, and housing. I say advisories are important, but if you're just stopping at an advisory, you're not really getting full inclusion, because they can be helpful, but they're not everything. How do we have organizations as partners? So we get advisors as individuals, ideally ones who can speak to the experiences of many. What are those community organizations we can partnership? How can we co-lead projects? So in our instance with the landlords, several of our advisors are authors on the paper, the comment piece that's nearly published, be out very soon, on a poster, on a talk we're giving. They're co-authors, and co-authors on our strategy for engaging governments. We have lived expert governance as well at a number of different layers. Just going to keep moving along here to be mindful of the time. So like next steps, we're going to continue to follow this narrative about landlords. We're, like I mentioned, enter this into that complex systems frame. We're already doing this with a number of municipal governments, is because municipal governments can create laws or bylaws related to something like, let's say, maximum indoor temperature for people living in poverty who don't have air conditioning. And but if you don't implement in a way that, for example, addresses what landlords can do to stop you or to help you, then you're not going to get too far. So that's an example of where we can use our networks to try and get this information out to help people work this into their plans for people experiencing poverty. One thing I can't talk enough about that I'm so excited about, I love this work, is participatory action projects. So we, with youth, for years I've been doing this, but recently as well in the climate space. When we go to communities, this has included asylum-seeking youth from Rwanda who live out in the west of Canada, Indigenous communities in the north of the Northern Territories of Canada, and in Toronto, Black communities around Toronto and Hamilton, the area here, to come together, provide some resource and provide technical support. And the community leads a project that they think will have an impact on the area of climate and health equity. It's the best. This is where collaborations, with Indigenous partners have been so fluid, have worked so well, because I'm not in the way. I'm not the expert. We're not the experts. What we're doing is facilitating and helping. We're being a connector when we're needed and when we're invited. And ultimately, and this is getting maybe touched on much more effectively by Patricia than I, but these communities, they own their films. Like I'll be able, maybe afterwards, we're just about to do screenings of the films I'm mentioning, but they own these products. We can only use them and with their agreement, with their permission, and in ways that we all agree about. Okay, and home stretch. So takeaways about inclusion. I've already talked about scaling out an inclusion as being kind of interdependent if you're doing both things right. There are foundational pieces essential to both. And I think I think you've made a mistake if you think my work's inclusive, I've achieved something. It's continuous. And I think having, as individuals, as organizations, as groups, always interrogating oneself, I give a few examples of questions. Who's missing? When we look around the room, who's not here? If we think about disabilities, queer, trans, and two-spirit communities, think about older folks, think about younger folks. Like, just be systematic, think about Indigenous communities, and that's a broad term, so we think about the range of people and communities that live under the term Indigenous, and how that representation is done, and what leaders are there. How can I reduce duplication, learn from earlier attempts? I've touched on a fair bit. Just thinking about where like participatory action projects, for example. I know they work with youth experiencing homelessness everywhere, from First Nations youth in Northern Ontario right through to youth and children and youth in garbage dumps in Managua, Nicaragua. We've done these by youth for youth projects. They work. So let's keep at it. And then also, what are those signs when I'm only achieving participation versus inclusion? Those moments when, yeah, you have an advisory, but the advisory is not really talking about the problem that's the focus. It's kind of all over. You can tick a box that you've got an advisory, but the advisory is not really doing what you hope. And then you get into tokenism, which can feel kind of, it's nice to say you've got inclusion, you've got an advisory, but you want to scrutinize and you want to iterate on that. Now, this, I am definitely not in a good position to speak a lot about this. I've done some. Patricia is going to speak much better than me. But here's a paper that I found that might be worth a look. I've talked a bit about my efforts, my humble efforts at First Nations, Inuit, and Métis engagement. So I just would say that if we're talking about impactful inclusion, some of those principles will apply to engaging diverse Indigenous people and communities. But then obviously, and hopefully it's obvious to this group, that there are many really foundational elements that are quite different, but many histories of genocide and systemic racism, not just histories, present contexts as well that fundamentally shape the interactions and the frameworks within which we understand what are the inequities and problems and the violence is unfolding, and then what needs to be done. And then the fundamental knowledge systems that are needed, and there, where I know in our work, we've engaged Indigenous elders, First Nations elders, a fair bit in what we're doing, and fundamental frameworks. Some people have employed a framework called two-eyed seeing as a framework. The idea that one eye is based in Indigenous cultures and bases of knowledge, and the other eye is based in non-Indigenous cultures and knowledge. And if you bring them together, effective work and partnerships that are equitable happen. Diane Longboat, an Indigenous elder we've spent a lot of time with, she's talked more about, this is a North American Indigenous frame where agreements and frameworks were set up in wampum belts, which are sort of like belts with beads that have different patterns that signify important agreements and understandings. And her suggestion, she didn't like the two-eyed seeing frame. To her, it was more the two-row wampum belt, the idea that there can't be two eyes that are connected per se, but there are two rows that can be in their own place, that can go forward together, but have a separation and will never be fundamentally the same, but can complement one another. So a small example of a framework that was important in our work and speaks to our work. Many folks who are leading Indigenous efforts around the world are so stretched. We want to make sure that I really try to make sure I'm only reaching out and connecting when I think I can offer something. I've already shared a bit about the work I've done in this area. And again, Patricia is going to be in a far better position than me to expand on this work based on her experience. So that's it. I'm going to stop sharing. I really, really appreciate your kind attention. I hope I've spoken slowly enough for people translating in their minds or people who are doing the actual translation. And I'm happy now to stop talking and pass it on.
Thank you. Thank you so very much, Jan, for a fantastic presentation. Very inspiring, and really using this homelessness as an entry point to show some very important points that we have been trying to wrap our heads around and to move along, know how to deal with vulnerability, with the differentiated approach that's needed at a local level, really depending on the context. Also, I think the point around services and access, what kind of access barriers are there? Very often they're related to the mere design and the mere of what is being offered. That can be great intentions, as you say, but they can. I think the couple of concepts also you introduced very interesting, like this reckless hopefulness. I think it's really important that can, in the worst case, lead to cynicism, as you mentioned. And then very strongly, going even beyond participation and really talking about inclusion and making sure that everyone who has a stake, if you want, is there and is really, this is co-designed, sometimes from a very small base, but very, very meaningful. That also this complex systems analysis, I thought was very important, that these are not simple problems that you can solve with simple solutions, and that might also sometimes, make us a little bit, it's daunting, it's difficult, but it's necessary. And so a couple of things, that of course from my language, I would say that really talking about the structural social determinants of health, what really determines why are people in homeless in the first place, and how do you, what are the forces and the powers that you need to work on, focus on prevention that you put there, localized action, inclusion, and also the same sustainability, or as you call it, scaling out, that to make sure that it's there. So again, thank you so much. I have by no means done justice to your presentation with this summary, but I thought it was some very interesting, very, very relevant points. So when we're talking about climate adaptation, or mitigation, even worse, but also climate adaptation, that we really make sure that we are thinking about, those being left behind and why and what do we need to do differently. So I'm going to invite people, the over 800 people who are here online listening to you, Sian, to put their questions into the Q&A so that we can follow up on that. So thank you again so very much and stay with us for the next session.
Oh, my
So
pleasure.
ahora entonces Patricia Suárez Torres, ¿no?
And so now Patricia Suarez
La persona de
Torres
Colombia,
from
que nos
Colombia
va a hablar, ¿no?
is
Yo voy
going
a leer
to
nuevamente en
speak
inglés muy
to
brevemente,
us.
¿no? Todo lo que ella ha
Um,
trabajado, ¿no?
I'm
She's an
going to
indigenous
briefly read
people
her CV.
from the Muray peoples in the Department of Amazonas, Colombia, with a very wide experience, both in Colombia and beyond, no, with leadership in the communities, in the indigenous peoples, and a defender of human rights and territorial rights. So, Patricia, the floor is yours. ¿Estás lista? Adelante.
Are you ready? Go ahead.
Bueno, buenas tardes.
Well, good afternoon. I'm going to apologize because I'm not going to be able to turn my camera on. I'm in the territory and I don't think the bandwidth is enough. I hope you can hear me well. Thank you for inviting me. These spaces are so important at times like this, where we find ourselves as a humanity having to recognize ourselves. And from the Colombian Amazon, we think this is a requirement to be able to build the bridges that the world requires today to heal, to collaborate, to see if we can extend life a little bit beyond what current research and scientific analysis are telling us, that we are so close to this point of no return. So it's key to meet like this at times like this. And so it's important to tell you who we are. When I say we, I mean the indigenous peoples of the Colombian Amazon. We are 64 peoples living here, distributed in 6 departments, as you can see in the map. It's also important to acknowledge and mention for people to know that there are 16 indigenous peoples that are in their natural state in these territories. And that is a concern we currently have because of the impacts and what they're suffering as a consequence of climate change.
Also, we are located in 6 departments of the Colombian Amazon, where we protect 27 million hectares. And every day we face the different threats and pressures on our territory. And we will continue working until the end of time, or as other people say, until the sun goes down, because one of the mandates is to protect life, not just for us, for the whole of humankind. It's our responsibility from the very beginning. I would like to say that as this is a space to reflect about health and adaptation, today we would like to say from the Colombian Amazon that health is harmony. Amazon indigenous peoples consider that health is not just human, it's the inclusion, everything that we can find in the ecosystem in the territory. And it implies connections that go beyond just the physical relationships. It is complementing social, natural, spiritual life of every being in the territory. When these harmonies are destroyed, then life gets ill in our territory. And we know this very well because this is what we're undergoing right now as a consequence of the lack of harmony caused by climate change. Therefore, saying health equals social harmony, natural harmony, and spiritual harmony. It's a requirement that is essential. We need those synchronicities and articulation in the ecosystem so that there is physical, spiritual, and social balance. The balance that we describe and live through in our territories. Let us now go to slide number 4. How do we show that right now there is an imbalance in our territories? First of all, if we pay attention to the world, its symptoms and signs, the world is showing us symptoms that we need to pay attention to. Grandparents tell us from their governance systems and knowledge systems that there is this huge risk for our cultural and life survival in the Colombian Amazon. We are now facing very strong heat waves. These heat waves were not as strong as they are now, as they have been for the last 2 years. But we also go through critical times when water sources, rivers rise in their levels, and they affect crops and the lives of many colleagues and indigenous peoples in the Colombian Amazon. Rivers, as you can see, they are growing more than is usual, and it's very difficult for us to face heat waves and rising river levels that jeopardize our lives. It's also important to mention that one way to assess the impacts of climate change have to do with the ecological calendar. We have an ecological calendar that that follows the seasons and life cycles of the territory. But with all those impacts and effects, the ecological calendar does not really is not aligned with the reality in the land. The harvesting season has changed, other seasons have changed. Some seeds and species in the territory cannot survive. And this impacts the food sovereignty of indigenous peoples to a great extent. These lack of order regarding when the summertime is, when wintertime is, shows us that we are at risk as a humanity, and we need to face these situations. Because if we do not, it will be very difficult for us to be alive for much longer. As my colleague said, in the Amazon, we are now going through different situations, and I would like to share with you an experience regarding what indigenous peoples are doing to face these impacts caused by gold mining, oil extraction, and the use of chemicals, which is really affecting us. A few years ago, in one of the territories in the Amazon, they conducted a study where they found a high rate of indigenous peoples that have mercury in their bodies. And nothing has been done by government institutions to find a way to mitigate this situation. And from the cultural perspective, the authorities have taken this process to learn how to clean and harmonize the life and bodies of people living with a high mercury level. Therefore, I think it's nice to share with you that after several opportunities to talk to our grandparents, one of the strategies that is very important and is that we need to go back to our own foods, to the foods grown by indigenous peoples before mining arrived, and also fishing not from the Rio Grande, but from smaller streams with no mining to prevent the mercury from increasing in the body and from further jeopardizing these people from the indigenous peoples. They have a huge role. We need to say that those of us who were born in indigenous communities were born because we have a role to play. And if one of those roles is affected within our peoples, then there is this imbalance. And let's imagine that we are like removing a table leg, and one side of the leg will not be stable if that happens. And that's exactly what happens in indigenous territories and indigenous peoples. We've also reflected about the problems in the territories. What are we going to do now then? Well, we need to awaken these opportunities, these feelings, and these healing opportunities for the world. But we also reflect that when the causes of the diseases and imbalances come from the outside, which is a case of mining, contamination, extractivist economy, and agricultural expansion affecting our lives, we say that healings needs to be shared, and it must come from outside as well. Right now, what wise people and grandparents do is not enough. Spiritual management is not enough from their communities, because these are diseases and imbalances that are coming from outside and then require coordinated attention and action. It is important to remember that indigenous people consider that healing comes from the territory and from spirituality. And this is why the role of the leaders of these wise people is so important. We need to conduct this healing from the territory so that there is life in the future. It's also important to mention that these diseases came from the outside, so the healing needs to be inside and from the outside. We have also seen that we need to really take a moment with the person creating the disease. The parties need to meet. Otherwise, it will be very difficult to implement these healing processes. Also, and based on this process that we have been going through, we have seen impacts and difficult situations in the territory. In one of the communities I know, just an example, women, when we had COVID-19 in 2020, the women went through very difficult situations. There were times of very hot summers where grandparents had a lot of issues that had to do with lack of food. Because the heat waves were so strong, they were not able to reach their farms to get food. They couldn't move around. And there were mobility restrictions in the communities because we had to look after our grandparents. And in this situation, grandparents went through a very difficult situation. But also, communities went through difficult situations regarding the lack of institutional presence. They had no medications to the medications they needed. Therefore, this is just an example of the role and importance of women in the different territories, because women, after identifying all these problems at the end of 2020, they started building orchards. Indigenous communities do not build orchards next to our house. they are in other places, in the spaces where we grow foods. So considering that they were not strong enough to go to the chagras to get food because they were far away and the sunlight was too strong, the community women started to build orchards. And in the orchards next to their houses, they start sowing all the plants that until now had been forgotten or left dormant because there was no need to have them close. So they are now recovering these medicinal plants to prevent several diseases that we didn't have in the territory before, and therefore these plants were not part of the community's lives before. But they also started a process of creating community chagras in order to sow food for their grandparents who cannot walk to the chagras because they're not strong enough, sunlight's too strong, and it affects the grandparents' bodies. But also because in the last few years, the sea level increase has really affected the people sowing foods on river banks. This is why food availability is so much affected in the territory. But now there are collective chagras where they sow foods to share with their grandparents because so the grandparents have the necessary food. That's important to remember. Also, the children in the community, for instance, started implementing a process. It's a nice one. It's a nice project to share. It's called Children Looking After the Water. And what they do is plant trees near the riverbanks so that the water sources can be protected. And so that there can be shade when walking along the river. Something we see on the screen as well is that it's necessary and urgent for indigenous peoples' knowledge systems that live in the Malocas, Chagras, etc., in the different fora, can also use the knowledge of non-indigenous people that live in offices and other spaces. It is urgent now that scientific knowledge systems and the knowledge of indigenous peoples can meet to find solutions and face what's happening to us right now. Also, we would like to share with you that we have some healing principles, and these principles are very much connected to our daily lives and also our cultural principles provided by our grandparents. One of those principles and lessons, some of these principles and lessons we should remember in this opportunity are that, first of all, we shouldn't just heal in the territory. We need to heal the relationships that are interdependent with the territory and everything that exists with it. It's not just about healing human relations, but about the comprehensive territory actions. It's also necessary to have a connection between knowledge systems, scientific knowledge, and indigenous knowledge. And that connection needs to be strengthened with a strong relation between health and climate. We also need to protect the sacred places of indigenous peoples that are now being affected by mining, also the wood industry, many other actions in our territories. And the situation depends not just on indigenous stakeholders, but also national authorities, because we need to protect this land from a comprehensive territorial and spiritual perspective in our daily lives. It's also important to remember that governments and indigenous peoples have very important knowledge they make their contributions, and also protecting the territory and having it's important to have the necessary legal framework to guarantee this debate. Also, as we can see within the COP30 and the different biodiversity scenarios, it's important to come together, but also to acknowledge contributions and also getting closer to territorial reality so that indigenous peoples can effectively participate and so that we can find a solution together. It's also important to say that within the COP30 process, Colombia, its government, and the indigenous peoples have been working together to help heal the territories within the update of the MS 3.0. The government of Colombia has done something very important, which we consider a healing strategy as well. It entails implementing action regarding this NS 3.0 with indigenous people. And for the first time, us indigenous peoples are actually influencing national mitigation and adaptation actions. And that's very important for us because it's the acknowledgement we have been demanding. So now it's becoming true. Therefore, these actions need other actions from institutions and governments so that this full harmony between society and nature can take place as soon as possible, because we are at the point of no return. We will be living through the worst of climate change, us and also the indigenous peoples living in that natural environment, as they depend exclusively on biodiversity. And these territory healing actions and cultural actions also be important, but it will be impossible to mitigate all this if we do not start participating in decision-making fora. Also in Colombia, we have some debate opportunities. We have been talking to the national government, as in the Amazonian space debate. And there's also another opportunity where we defend our rights, is a permanent consultation table where we work with 115 peoples in Colombia.
En el marco de la actualización de la ANS, logramos una meta global, 12 medidas, acordamos 12 medidas.
We have achieved a global goal with 12 agreed measures and 40 postulates. And the government of Colombia has officially included the contributions from the indigenous peoples into these official documents. And so mitigation and adaptation goals are going to be key in order to ensure our life plans and our knowledge systems are going to be fundamental in considering the impacts of climate change. And we have 12 measures that include a coordination between the government and the indigenous peoples. There are also contributions for the energy transition, the care and healing of indigenous territories in adaptation to climate change, strengthening the healing measures with intercultural actions, contributing to mitigation and adaptation. It's all that I have been discussing, like the importance of working in coordination between indigenous governments and indigenous peoples and the governments, and defending the Mother Earth as guardians and traditional healers. We need to be involved, and there are also some considerations about traditional knowledge and a reference to the importance of working and deciding on our own health. Apologies if I took more time than I had. Thank you, Patricia, for your interesting presentation about the knowledge of the indigenous peoples working from your territory. And thank you for drawing our attention to the fact that the planet is sick. And if we don't work jointly in this, and also the spiritual dimension, we will not be able to make life possible for longer. Of course, as you mentioned, the calendar, the cycles of nature have been affected. This, of course, affects our nutrition, and this requires measures from all levels of government, from the national to the local, and of course, global actions.
600 questions. No, I'm exaggerating, but there are a lot of questions and there's a lot of interest. So I'm going to put each of you a question for Sian and then also one for Patricia that are related in a way, because it's about how to create synergies, you know, how to make sure that we work in the same direction. So there's a question here for Sian, which I think is good, is how can we overcome, I'm looking for it among the many, how can we overcome the lack of integration between actors involved in addressing these issues that you put on the table? And while you think, Sian, I'm going to give the question for Patricia. Yo creo que también es muy relevante, Patricia, porque
and I think it's very relevant because we have questions on how we can coordinate ministries, so the central government, with ancient systems of knowledge. So I think with those two questions, we can round up an awesome session.
In different ways because I don't know how to say it. So tell us, and please go ahead.
Sure. Yeah. That's totally fine. I also go by Sean, but either way, it's all good. It's all good. Thanks, Jerry. Yeah, no, what a tricky question, I would say, is trying to get alignment. One of one of the key forms of complexity, of the many forms of complexity here, is governance complexity, where the issues of poverty, climate, health, and well-being are across all levels of government, from city and municipal through to a country or federal governments, many different departments and ministries. And it's a challenge in that context to get alignment, and because it's so easy in many ways to say this is somebody else's problem, it's another government level's problem, it's not my department, or I only focus on this small bit. I guess I'll just share a few things that I try that I use to bring people together. One thing that I repeatedly come back to, there can be an inclination to make the problems faced by people experiencing poverty as individual problems, and as well to sort of make them the problems of those poor people. I'll use that term over there. So how can we understand that just like the COVID-19 pandemic had an impact on the whole of society, and the well-being of people experiencing poverty is the well-being of all society, wherever possible, I will use that language and try to avoid othering, is the term that's sometimes used, othering people experiencing poverty, so that it's not about helping those poor people over there, because I don't think we ever get very far with that kind of an approach. Also, there are ways of applying economic analyses to look at co-benefits, for example. Also, and representation, we're talking about inclusion here, is bringing people to the table. We can sometimes operate under the assumption that governments and people in government are universally pessimistic and cynical and so forth, but having people with lived expertise at the right time and place coming forward can be impactful. These are just a few thoughts of the many, many things that can be done. But I definitely, it's a challenging area for sure.
Thank you very much, Sean, and very important insights on that. So, Patricia, quizás un segundo puedes poner la cámara para
so,
ver.
Patricia, could you try and turn your camera for a sec? Otherwise, no problem. Yes, sure.
Te escuchamos.
We can hear you, we can't see you, but that's okay. Okay, well, just to say that the indigenous peoples in Colombia, we don't go to the streets to protest. And so one of the strategies that we have used to work with the Colombian government is with the spoken word and with our actions. And so when we say we need to protect the territory, we take action to protect the territory. And so by living those actions of care, of managing the territory, we make those government entities, those allies want to be involved and join us in that process. But we also work through legal claims and through the judiciary, because our whole struggle in the Colombian Amazon is something that we have also made progress by winning court cases, because the geographical place, because of where we are, we're not able to close down an airport, we're not able to close down a river. So we think that our struggle is in the spoken word, but also in our actions, and also the legal tools that we have taken ownership of. And always by joining words with actions. I think that mobilizes people and allows other stakeholders to take an interest, to come here to the territory. We're always open for anyone who wants to take care of the Amazon. Our wise elders say that anyone who has a pure heart, the Amazon will always be open for them. If they come with a heart that isn't pure, the Amazon itself will find a way to kick them out. And so everyone is welcome. Thank you for listening. Thank you for trying to understand, because you can only understand truthfully when you live with our reality.
Thank you so much.
Thank you
for both of you and for everyone who's here. And I just want to close with saying we are very close to the COP. In 1 month, we're going to the next COP 30 in the Amazonia. So I think what Patricia just said, come with a good heart, come with good intentions, because if not, the Amazonia will not treat you well. And also, please, let's make sure that on the agenda of the COP, and particularly in the health agenda, we have the topics of equity ingrained. So that is not something, on the side. So really, I invite everyone to make sure that this topic is really heard. The Belém Action Plan has this very central, also talks about participation. So I really think this is a fantastic opportunity to push this agenda and to make sure that we integrate equity, the voices of those most affected and left behind in the agenda in the COP30. So again, thank you so much for the organizers, for everyone here. Fantastic session. And I see everybody is putting congratulations in the comments. Los comentarios están llenos de felicitaciones. Thank you so very much.
Thank you very much.
Muchas gracias a todos.
Thank you so much, everyone.
Ya, un gusto.